So you remember how they count COVID? They overcounted COVID because this is how they counted COVID. Are you ready for this? This is health. I think this was the senior health advisor in Illinois.
I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
I wasn't expecting that.
So watch this. So that Lena Wen, she's that CNN Washington Post doctor she was a crazy COVIDian, but now she's coming around. She's dumber than a pothead comedian, and she's a doctor. Birx and Fauci reject Fox News promoted theory that coronavirus deaths are inflated. That's one headline. Here's the next headline.
That's from April 2020.
That's right. Opinion: we are overcounting COVID deaths and hospitalizations, and that's a problem. That's January 13th, 2023. So the Washington Post said that, it's that theory. No, we reject it. It's a Fox News theory. You see how they put it? It's a Fox News theory. It's Fox News theory. You mean it didn't come from the Department of Health in Illinois? It came from Fox News? That's how they report stories to split the country. So here's the new opinion. Here it is, and it's by Lena Wen. Here we go. According to the Centers for Disease Control and Prevention, the United States is experiencing around 400 COVID deaths every day. At that rate, there would nearly be 150,000 deaths a year. But are these Americans dying from COVID or with COVID? Now they're just getting around to asking this in the Washington Post in 2023. Something we've been asking since at least the summer of 2021. At least. It's good to see the Washington Post about a year and a half behind the Jagoff comedian. Wen also cited infectious disease physician Shira Doran, who figured out that in recent months, only about 30% of total hospitalizations with COVID were primarily attributed to the virus in Massachusetts hospitals, for example. Wen recounted Doran's experience at Tufts Medical Center, writing, during some days, she said, the proportion of those hospitalized because of COVID were as low as 10% of the total number reported who had COVID. So, way over-reporting. Mentioning the first, she wrote, Robin Dretler, an attending physician at Emory Decatur Hospital and the former president of Georgia's chapter of Infectious Disease Society of America, estimates that at his hospital, 90% of patients diagnosed with COVID are actually in the hospital for some other illness. So that's like by a factor of 9, right? Like 9, that's like to the 9th power. They're overestimating the deaths. I'm not a math surgeon, so don't quote me on the 9th power thing. Dretler told the analyst, since every hospitalized patient gets tested for COVID, many are incidentally positive. Wen noted how people with gunshot wounds or other serious illnesses often test positive for the virus and wrote, if these patients die, COVID might get added to their death certificate along with the other diagnoses. But the coronavirus was not the primary contributor to their death and often played no role at all. So when you see people out there tweeting, COVID killed 6 million people. I saw it today. Kyle Kalinske did it, I think. He has no idea what he's talking about. He's just repeating government propaganda. That's it. That's all that is. Now, we knew this long before these people. Dretler admitted this contributed to the imprecise reporting on COVID deaths and hospitalizations, which he added did not come from a place of bad intent. Fuck you. He denied that there was any conspiracy behind it to exaggerate coronavirus numbers for some nefarious purpose. Yes, there was. There was a conspiracy behind it to exaggerate coronavirus numbers for a nefarious purpose. Yes, there is. There still is. They get paid more. Epidemiologist Dr. Tracy Hogg responded to Wen's piece, stating, spring 2021, the United States had good evidence that greater than 40% of child COVID admissions were incidental. 2021, Denmark announced they distinguished with versus from COVID hospitals, and COVID plus deaths in Denmark in 2022 were 60 to 70% incidental. So they're saying we knew this stuff in 2021. Why does it take the United States Washington Post, their doctors, to wait till 2023 to say this? Because they're frickin' paid for by Big Pharma. The doctor added, amazing how long it has taken the United States to accept this as a problem. Yes. Center for Security Policy senior analyst J. Michael Waller slammed the Washington Post over the column, stating, not long ago, the Washington Post was calling us conspiracy theorists for saying such things. It's Fox News. The Australian journalist Adam Creighton tweeted, people saying this is a year ago were booted off social media. So the difference between a conspiracy theory and a fact is about 6 months to a year. Dr. Lena Wen slammed after admitting there's been overcounting of COVID deaths 2.5 years late. This is how I feel. I feel like this headline. She cited sources claiming that most patients diagnosed with COVID are actually in the hospital for some other illness. The article is titled, We are overcounting COVID deaths, and that's a problem. Wen's observations prompted readers on Twitter to complain, stating that it's 2.5 years too late.
Huh.
Here she is in July of 2021, pushing vaccine mandates as the only way to end the pandemic. You ready?
I think this really depends on what it is that we do at this point. So now we have this Delta variant that is much more contagious. Because it's more contagious, it's going to be even harder for us to reach herd immunity. We're going to have to vaccinate an even higher proportion of people to get there. What happens then if we end up having another variant developing that's even more contagious, that could cause more disease, that could evade the protection of our immune system?
So when a virus, as Dr. Robert Malone taught us on this show, when a virus like this mutates, it often becomes more contagious. Like she says, she leaves out the second part. When it becomes more contagious, it becomes less deadly, which is exactly what has happened to this virus. Now this virus presents the symptoms as a cold. Runny nose, headache, fever, mild body aches. She keeps saying, what about the next one? It's even more contagious. It's going to be more contagious, which sounds scary, but she doesn't tell you that second part. Why? Because she's a propagandist. And because her and everybody in her profession and everybody on CNN gets paid by Big Pharma.
And so how quickly we get this under control and which way we go depends on what we do now when it comes to vaccination, to overcoming disinformation. And what we really need to do at this point is to make vaccination the easy choice. It needs to be hard for people to remain unvaccinated. Right now, it's kind of the opposite. It's fine. I mean, it's easy if you're unvaccinated. You can do everything you want to do anyway. But at some point, these mandates by workplaces, by schools, I think it will be important to say, hey, you can opt out. But if you want to opt out, you have to sign these forms. You have to get twice weekly testing. Basically, we need to make getting vaccinated the easy choice. That is what it's going to take for us to actually end the pandemic.
So I knew more about the pandemic than she did when she said that, because I knew that wasn't true. I knew that because Dr. Robert Malone came on this show and told us that it's a leaky vaccine and you can't vaccinate your way out of a pandemic like this. He knew. And I knew before she's saying this on television, and none of these people know anything about what they're talking about, including her. If you came to this show, you would have got the accurate information. You go to CNN, you get medical misinformation. I bet that's never going to be taken down. I bet that's up on YouTube somewhere, and it'll never be taken down. It'll never be at CNN's Wikipedia page how they spread medical misinformation. Everybody, we're doing live stand-up comedy in Los Angeles in January and February in Los Angeles. And then we're going to Tempe, Palm Springs, Milwaukee, Minneapolis, Nashville. Go to jimmydore.com for a link for all those tickets and become a premium member while you're there.